Obviously, the fetal circulation in this fetal pig is different from what it would be in the adult. And being a fetus of a placental mammal, blood is going to and from the placenta to exchange gases, nutrients, and waste. So if one were to cut the umbilical vein, one could see the umbilical vein, the route that oxygenated blood would then enter into the body. It enters the liver and forms the sinus venosus, which will fuse with the inferior vena cava. And one can also see that the umbilical arteries, which enter the umbilical cord, are leaving from the hip region. And so here we can see the abdominal aorta, the external iliac arteries going towards the leg region where they will form the femoral artery. But here you can see the two umbilical arteries, which will then go to the umbilical cord. Now they are bringing blood which is largely deoxygenated to the placenta. One does not have oxygen going to the placenta in a fetus. And it is then the umbilical vein which returns from the placenta, which then has oxygenated blood. This passes through the liver and diverges and forms the sinus venosus, which then goes to the inferior vena cava, which then enters the right atrium. Now, the right atrium has a space. So if one were to notice, this is the right atrium and right ventricle. Here's the left atrium, left ventricle, and blood can pass right here through the foramen ovale, the oval hole, and be shunted away from the lungs, which are filled with amniotic fluid, be shunted from the right atrium to the left atrium. So here you can see that there is a space which does not exist in the adult heart. In the adult heart, this foramen ovale will close and form simply a depression, the fossa ovalis. From the right atrium, blood can be shunted to the right ventricle, to the left ventricle, and to the aorta. But of the blood which enters the right ventricle and is shunted through the pulmonary trunk here, so here's the right ventricle and the pulmonary trunk, some of this will then enter the pulmonary arteries and be sent to the lungs. Most of it, however, instead, will then rejoin the blood from the aorta. So here you can see that there is a smaller pulmonary artery coming from the pulmonary trunk. And in the adult, this is the primary function of the pulmonary trunk, to form the pulmonary arteries which go to the lungs. But notice that the much larger branch is here, this ductus arteriosus. It is a shunt through which most of the blood which is in the pulmonary trunk is then sent to the aorta, right? So it is here that the arch of the aorta and the pulmonary trunk's ductus arteriosus fuse before forming the descending aorta. And so this will close in adults and form a ligament, the ligament arteriosum. But in the fetus, blood is shunted away from the lungs, given that they are not performing gas exchange and are filled with umbilical fluid, and thus is shunted to the descending aorta instead. So fetal circulation is different from adult circulation, as one can see with the ductus arteriosus, which does not exist in the adult, the foramen ovale, the opening connecting the two atria, which does not exist in the adult, the umbilical arteries, which leave the hip region. These form ligaments in the adult, and in the adult, the umbilical vein, which enters the liver and forms a sinus venosus. This then forms ligaments, including the ligamentum venosum through the liver in the adult.